Hi, I'm Steve Miranda, BDM for the HCIS division for the West and Southwest for Carestream. And I'm here with Mr. Ron Milbank of Reno Diagnostic Centers in Reno, Nevada. We're going to ask him a few questions about his experience dealing with Carestream's HCIS division and what led him to our products. Ron, thanks for joining us.
Thank you, glad to be here.
I have a couple of questions, but maybe we should start off with if you explaining a little bit about Reno Diagnostic Centers for us.
Sure. Reno Diagnostic Centers is a pair of outpatient imaging centers that have been in business for over 30 years. We do approximately 75,000 exams a year across all modalities. We focus on extraordinary patient care, high quality imaging, and efficiency. And I'm glad to be here to answer any questions you have.
You know, it being in business for 30 years, you obviously had a solution prior to Carestream approaching you. What was your experience with that solution in your facilities?
Sure. When I came on board at RDC, we recognized an opportunity to use technology to our advantage to increase the efficiency of the entire operation, with a primary focus on making the radiologists as efficient as possible. When we realized that opportunity existed in the marketplace, we created a 75-page RFP. We sent it out to, I believe, 15 vendors that we identified as the top players in the risk pass arena. And through that process, we were able to narrow it down to a couple of vendors, including Carestream.
And what was it particularly that attracted you to Carestream's solution in that final phase?
I think in the final analysis, it ended up being the ability to implement your software technology that enabled us to eliminate multiple other workstations that we have to use to read exams. We had disparaging mammo reading stations, we had PET CT fusion stations, we had the regular RAD workstation, and when you added up the cost of those disparaging stations, the support contracts that go along with them, the training curve for the radiologist to learn all that software, the opportunity to lose all those and go into consolidated workstation was huge.
Interesting. Now you say you do about approximately 75,000 procedures a year. What kind of data are you generating at 75,000 examinations per year?
Data.
Yeah. What size archive are you using? How much data is it being?
So
being
in our current iteration of the Carestream solution on the PAC side, we have about 90 terabytes worth of storage. 17 terabytes of that is SSD drives in SAN, and then we have a secondary SAN with spinning drives with the remainder of that storage. We run in a VM environment that quite honestly is overbuilt for the application, but we're looking for every ounce of speed we can get.
You know, and seeing as how Carestream is supporting your environment right now, how do you see Carestream growing with your business? What are your plans for the future if you can reveal some of that to us?
Well, I think when you look at the deductions to reimbursables year after year, imaging is hard set focused on efficiency without destroying patient care and without destroying the quality of the reports that are being generated for the patients. So it's going to be about efficiency. How do the RADs have to interact with the software as little as possible to accomplish their job at a complexity and quality level that exceeds their competitors and is way above the minimum standard.
Interesting. And the patient experience, are you affording an opportunity for the patients to access those images, those reports in any fashion, or are there plans to do that in the future?
We do. We have both a RIS and a PACS portal. Right now, the overwhelming access to that information is done by referring offices. But we're seeing patients want more and more access to that.
Interesting. Ron, I can't think of anything else I need to ask you, so I'm pretty much done for the day. Thanks very much for joining us.
My pleasure.